Hello everyone, welcome to our presentation. Our experiment was to study the effects of an alternating treatment design on decreasing skin picking behavior. This project was completed by Joanna Alexander, Andrea Chalmers, Melissa Macias, and Laura Rothamer as part of Class 509A through Southern Illinois University. For our project, some keywords include skin picking disorder, alternating treatment design, redirection, self-injury, self-monitoring, duration of behavior, and cognitive impairment. Skin picking is a disorder in which an individual engages in touching, scratching, and picking their skin repetitively. According to the Trichotillomania Learning Center, skin picking can occur due to being afraid, anxious, or bored, which leads to the harmful behavior. This disorder can have a negative impact on an individual's life, as it can cause an individual to fixate on picking their skin and cause physical damage as well. Usually, skin picking is comorbid with another disorder, such as obsessive-compulsive disorder, body dysmorphic disorder, developmental disabilities, and autism. There have been various interventions found to help treat chronic skin picking. Lang et al. In 2009 used the application of bandages and reinforcement for not removing the bandages or damaging the skin to be effective in reducing skin picking. Previous literature has also found habit reversal training to be effective in reducing skin picking. Habit reversal training teaches strategies to help an individual refrain from skin picking. Labrat in 2015 taught a participant to become aware of when they engaged in skin picking and taught alternatives such as putting their hands in their pocket or holding their hands together. Cavallari in 2014 also applied habit reversal training by utilizing response training and allowing the subject to engage in sensory stimuli instead of skin picking. Martinson in 2011 applied habit reversal training with other various interventions to reduce skin picking in an adult woman who had chronic skin picking disorder. Past literature has also used competing activities as a method to reduce the occurrence of skin picking in individuals. Lane in 2006 combined competing activities with Adderall to reduce skin picking. The participant would manipulate sensory items instead of engaging in skin picking. Another study which found competing activities to be effective in reducing skin picking behavior was conducted by Ladd in 2009, which allowed a child to manipulate preferred objects during playtime instead of engaging in skin picking. Another method that was effective in treating skin picking behavior was a study conducted by Richmond in 1998 who used sensory extinction and praise to block any occurrence of picking and provided the participant with a toy to manipulate instead. Past studies have also found self-monitoring to be efficient in increasing and decreasing certain behaviors such as in studies by Sala and Wadsworth. Although there is not much research in the use of self-monitoring with skin picking, Tiger et al. 2009 found self-monitoring and differential reinforcement to be effective in reducing skin picking. The participant was taught to apply the intervention to himself by holding his hands together or putting them in his pockets to refrain from skin picking. Tokens were provided for increasing the amount of time the participant went without picking their skin. Since self-monitoring was found to be effective in reducing skin picking in only one study, we aim to extend previous research by examining if self-monitoring would reveal to be effective in reducing skin picking that occurs in 3 students. Also, there is limited research on the use of verbal redirection to treat skin picking. We wanted to investigate if it would be a successful alternative to reduce skin picking from occurring. Thus, the purpose of the current study is to apply redirection and self-monitoring through an alternating treatment design. Through this design, we will determine which intervention is more effective in reducing skin picking that occurs in 3 students with cognitive impairments. This study included 3 students in a self-contained classroom that is for students with intellectual disabilities in 3rd, 4th, or 5th grades in a public elementary school. These students had an additional diagnosis of either attention deficit hyperactivity disorder or autism. Each student involved in this study has a history of skin picking on various parts of their body, for example, scalp, arms, or legs. The interventions that were used as part of this study took place during typical group instruction. Students sat at desks and chairs during instruction. Group instruction includes up to 9 students, 1 teacher, and 1 classroom aide. Other materials for this study included a laminated tally sheet that was taped to the students' desks for them to self-monitor their skin picking. The dependent variable for this study is skin picking. Skin picking involves picking at the skin with objects such as their fingernails and/or pencils to the point of leaving scratches or drawing blood on various parts of their body, including the scalp, arms, and legs. There were two types of data that were tracked for this study. The data that was tracked by the teacher or classroom aide involved using duration tracking of the skin picking. The data that was tracked by the students was frequency recording on their tally sheets for self-monitoring. Data was collected on a daily basis for 15 minutes per session at the same two times, once in the morning and once in the afternoon, every day. Inter-observer agreement was calculated for 5 of the 12, 42% of the intervention sessions. Mean scores of inter-observer agreement were 92%. There was a social validity questionnaire developed for these two types of interventions. There was one for the teachers to complete, as well as one for the parents. The team felt the intervention was valid to academic and functional improvement of the target students, as well as social and health improvement. The current study utilized an alternating treatment design to evaluate the effects of redirection compared to self-monitoring on decreasing skin picking. The team felt alternating treatment design was ethical for all target students in order to determine the most effective intervention quickly. All students suffering from skin picking were receiving both interventions, and it would be determined at the end of the study which intervention was more effective on decreasing this behavior. Baseline data was collected for 5 days during the same two 15-minute sessions each day, once in the morning and once in the afternoon. The intervention took place for 6 days during the same two 15-minute sessions each day, again in the morning and afternoon. Self-monitoring and redirection interventions were randomly assigned to equal amounts of morning and afternoon sessions. The self-monitoring method included use of a laminated tally chart for the student to track their frequency of skin picking. All conditions were balanced across the two stimulus conditions equally. To randomize which stimulus condition received the specific treatment condition, each treatment was assigned a heads or tails on a coin. The coin was flipped 6 times to randomize the presentation of the treatment conditions. For student A, the average duration of skin picking behavior during baseline was 365 seconds out of a 15-minute or 900-second observation period. During the alternating treatment design, the average duration of skin picking behavior during the redirection intervention was much lower than the self-monitoring intervention. The average duration of behavior during the redirection intervention was 84 seconds. A final intervention, implementing only the redirection phase, found that the average duration of skin picking behavior reduced even lower to 75 seconds per 15-minute time period. For student B, the average duration of skin picking behavior during baseline was 316 seconds out of a 15-minute or 900-second observation period. During the alternating treatment design, the average duration of skin picking behavior during the redirection intervention was also much lower than the self-monitoring intervention. The average duration of behavior during the redirection intervention was 68 seconds. A final intervention implementing only the redirection phase found that the average duration of skin picking behavior was reduced slightly lower to 66 seconds per 15-minute time period. For student C, the average duration of skin picking behavior during baseline was 310 seconds out of a 15-minute or 900-second observation period. During the alternating treatment design, the average duration of skin picking behavior during the redirection intervention was much lower than the self-monitoring intervention. The average duration of behavior during the redirection intervention was only 64 seconds. A final intervention implementing only the redirection phase found that the average duration of skin picking behavior was actually slightly higher in duration, lasting 77 seconds per 15-minute time period. The results suggested that verbal redirection was a more effective intervention at reducing skin picking behaviors across all 3 participants. During baseline, the average duration of skin picking behavior across participants was significantly higher than either intervention per 15-minute observation. Data collection showed that the duration of skin picking behavior was significantly less in duration during the redirection intervention than during the self-monitor intervention. A final phase of redirection as the only intervention was introduced at the end of the experiment to test the strength of redirection as an intervention. This phase lasted for 6 sessions. All target participants continued to have decreases in duration of skin picking behavior during the redirection intervention when compared to baseline and the self-monitoring intervention. Redirection and self-monitoring with an alternating treatment design was studied as potential interventions to decrease skin picking for 3 students with cognitive impairments, in addition to ADHD or ASD. The results suggested a functional relationship between both interventions, redirection and self-monitoring, and the decrease of skin picking behavior across all 3 participants. Redirection was suggested as being more effective as an intervention. Past research on interventions and functions of skin picking behavior have included individuals typically exhibiting skin picking behaviors when bored, anxious, excited, or scared. The current study built upon previous research, such as the use of simplified habit reversal by Labrat in 2015, Cavallari in 2014, and Martinson in 2011. Also, competing activities combined with medication, Lane 2006, and sensory extinction and praise, Richmond et al. 1998. The results of the current study also extend previous findings on the use of self-monitoring as an intervention to treat skin picking by Richmond et al. In 1998, Statsala in 2014, and Wadsworth in 2015. This study focused specifically on the effects of 2 interventions, self-monitoring and verbal redirection. History was a potential threat to internal validity. The study did not take into account whether events outside of the intervention at the time could have impacted the behavior outcome. An improvement for future research would be to ask the parents if any situation may have influenced the participants' behavior. Also, the students could be asked how their day was going. One limitation was that although the redirection phase seemed to decrease the skin picking behavior significantly, there is the question of clinical significance that remains. Ideally, results indicating 0 time for skin picking is needed. A future improvement could consist of combining redirection with another method to see if they would improve the results. A second limitation is that redirection as a treatment intervention has not been explored as much as other interventions. A future improvement could consist of identifying variations of redirection and, again, hopefully to increase the clinical validity of the results. A third limitation was this study did not involve any long-term probe. A future improvement could consist of a follow-up data in future months or years. A fourth limitation was that the study did not probe for generalization in other living situations. In the future, an improvement could consist of including probes to test for generalization. The last limitation was that a functional analysis of each individual's skin-picking behavior was not completed. Even though past research suggests it is a sensory function, this was analyzed for each. A future improvement would include a functional behavior analysis that could be used to explore the individual's function of the specific behavior skin picking. In summary, the results from this study suggest that verbal redirection helped reduce skin picking behavior with individuals with cognitive impairment more than the self-monitoring intervention. As this is a newer area of research for this intervention with skin picking behavior, future research is recommended. This last slide contains all of our references used for our experiment. Thank you so much for watching our presentation. If you have any questions, please feel free to follow up. Thanks!